problems with the gallbladder are very, very common, and a lot of people will come in with episodes of pain or discomfort, normally up on the right side, sometimes with some vomiting, and this may become a recurrent pattern. Some people may have a very severe attack and inflammation and come into hospital with that. And really, we look at options going forward then. Gallbladder stones themselves are very, very common. And if we just randomly scanned a lot of people, we'll probably find stones. But when they start becoming symptomatic, they tend to start causing recurrent issues and recurrent problems. And when we get into that pattern, then really we're thinking of how do we help and how do we treat? And so if we want to think of the most conservative measures for that, for some people who maybe have very minor symptoms or who want to try options, we normally start with a low-fat diet. As the gallbladder contains bile, and when you eat, it starts contracting and producing bile and helps digest that food. And if you've got stones there, it can cause problems. However, that's not 100%. And so really we come to definitive measures of treatment. And really the effective treatment that I think nearly everyone would recommend is surgery to remove the gallbladder. And so we really think about surgery at that point in time if it's been having recurrent issues or recurrent problems or recurrent episodes of pain. A definitive treatment is really being sought for. Gallbladder surgery itself is a very common procedure. It's a procedure which nearly always we can do by a keyhole method of doing, so laparoscopic surgery. And what that would typically mean is under a general anaesthetic, an operation where typically 4 small incisions are made, all these very, very small, a centimetre or 2 in size in the tummy. And if you like, with keyhole equipment, we go inside, we use gas to blow the tummy up, and then we can see the gallbladder. And for gallstones, we take away the whole gallbladder rather than the stones just themselves. And so using keyhole surgery, the gallbladder sits just under the liver, and we look at the tubes connecting the gallbladder to the bile ducts, which then drain bile into the bowel to help digest food. So by careful dissecting those out, we can identify those. And what we would typically do also is a little dye test into those tubes. It's called a cholangiogram. That dye just shows all the anatomy of the bile ducts going into the liver, but also just confirms there's no stones which have hidden out that could cause recurrent problems. After that, we put clips on the tubes draining the gallbladder and the blood supply to the gallbladder. We can then divide that and then remove the gallbladder from the liver itself. Normally, we then put the gallbladder in a little bag that we can remove via typically via the belly button to remove that. And they can close those little wounds up, and typically most people can have that done as a day case operation. Some people, if they're taking a little bit longer to recover or have other medical issues, normally an overnight stay, but as I say, most people recover really quite quickly from that, and recovery time at home normally a couple of weeks or so. So as I said, normally if people start getting problems with the gallbladder and trouble with gallstones, it normally heralds that they were having recurrent attacks. If someone really says that I don't want surgery, or it may be higher risk for whichever medical issues, and we've got the options of really trying to maintain a very low fat diet and reducing the risk as much as possible. But despite that, recurrent symptoms can happen. And so it's something always to keep open, the option of re-exploring if you feel it's not right at the right time for you at that point. Re-exploring would surgery be an option going forward. There are risks of more severe attacks, and that can mean a hospital admission and antibiotics to try to treat an infection. And more rarer complications after gallstones could be something called pancreatitis, an inflammation in an organ just behind the stomach, which can be really quite severe and really cause quite severe problems. So typically, if people are really getting recurrent symptoms or severe problems from the gallbladder, that's very much we would recommend exploring the options regarding surgery. Non-surgical ways, really, we are looking at low-fat diet really to try to prevent symptoms from gallstones, and that means maintaining it long-term, really, if we're trying to avoid that. Other things that have been tried at special medicines to try to dissolve the gallstones within the gallbladder. if we're honest, unfortunately, most of that time that those don't work very effectively, or one of the issues the gallstones reform and recurrently cause problems. So I think it's fair to say most surgeons would recommend, if they are causing recurrent symptoms, really to consider definitive surgery for it.